The doctors think I had it for like all my life.
Raul is talking about his brain condition that could trigger seizures and cause panic attacks. Things got bad 4 years ago when a blood vessel mass in his brain burst, causing bleeding in his brain.
I didn't have a doctor. Somebody found me unconscious and they took me to Union Hospital.
Raul, like so many in New Mexico, needed life-saving medical care, but he lives in the U.S. illegally, and getting health care has not come cheap.
This is my neurologist.
Raul has since recovered, but still suffers from occasional anxiety attacks. He showed us one of his recent medical bills, $772 for a visit to UNM Hospital. Because of his condition, he has no job and no way to pay for it himself.
That doesn't concern you?
It does, but what can I do about it? Like, I don't want to be stressed anymore.
Raul joins millions of undocumented immigrants who are in a similar situation. The Pew Research Center says of the 10.5 million illegal immigrants living in the U.S., about half need health care. Undocumented immigrants do not qualify for Medicaid or health care through the federal marketplace established by the Affordable Care Act. Immigrants under Deferred Action for Childhood Arrivals, or DACA, cannot apply for Medicaid either. Felipe Rodriguez, who works with the New Mexico Dream Team, is also undocumented.
We see healthcare as a really big check.
So Felipe usually opts for home remedies.
If home remedies doesn't work, we try, maybe we ask our grandma what to do.
He says the last resort for many immigrants is going to an actual doctor because...
And there's also this just like fear in our community.
Fear of deportation.
So what do you do if you don't go on regular doctor visits and skip out on preventative care? Well, some have to resort to this, the emergency room.
The ER ends up being where many immigrants could get their services paid for completely. It's where Raul was taken to when he had his brain bleed years ago. And federal and state funds foot the bill in New Mexico. It's called Emergency Medical Services for Aliens, or EMSA.
Which will cover an emergency situation for a non-citizen individual with no immigrant status.
Shanita Harrison oversees income support offices for the State Human Services Department. Her office determines health care eligibility for all kinds of immigrant statuses, from those awaiting permanent residency to asylum seekers. But for the undocumented who cannot receive traditional Medicaid benefits, EMSA is often what comes to the rescue.
Typically, you'll talk to the hospital representatives, and the hospital will understand that you're uninsured and that you need help. And so the hospital will typically submit an EMSA application on your behalf to the Human Services Department.
But not everyone fully agrees with this process. New Mexico GOP Chairman Steve Pierce says he's had to consider tax-paying citizens when he served as congressman of the district spanning southern New Mexico.
All of us have a sympathetic ear to those people who come with desperate problems. But the average person who comes here illegally getting free health care is one that really is offensive to a lot of voters who've lived here their entire life.
So how much has the government shelled out to subsidize hospital costs for emergency services for non-citizens? EMSA claims totaled $9.7 million in fiscal year 2019, according to the Human Services Department. $2.7 million of that were state Medicaid funds, while the rest were federal dollars. The Human Services Department averages about 300 or so EMSA applications in a given month. Harrison points out more than 1 million people in the state receive Medicaid benefits.
So it is a fraction of a percentage of our overall total cost.
The question is, could this be avoided altogether?
We want to try to catch problems before they become emergencies and create a health crisis that costs a lot.
Nonprofit group Health Action New Mexico advocates for health care for all. Their proposed solution is to expand Medicaid and allow people, including non-citizens living in New Mexico, to buy in to Medicaid options.
What we're talking about is actually opening it up so that people could actually purchase that coverage if they don't qualify for it.
California, for example, is already making moves to expand its Medicaid programs to young, undocumented immigrants. But whether all New Mexicans are on board with that happening here is uncertain.
To say that we're going to expand that group by the hundreds of thousands of people who are coming in here is a burden that people who have paid into the system their entire life say, wait, what about me? I don't get it free of charge.
For Raul, he's just grateful EMSA payments have been available to help him.
Because If there wasn't for that program, I won't be able to afford medical care.
In Albuquerque, Christine Pei, KUAT Action 7 News.
The New Mexico Department of Health provides safety net services regardless of immigration status at public health offices statewide. That includes WIC, preventative medicine like annual checkups, family planning, and immunizations.